Seniors, listen up. It's your favorite internet doctor, Dr. Mike, here on Ali Khan's channel. Thanks for having me, Ali. We've got an important topic for our senior viewers or anyone caring for an older adult. Fruits are packed with vitamins and are generally healthy, right? But could some fruits be posing hidden risks, particularly concerning leg strength and mobility? Today we're diving into 5 common fruits that might not be the best choice for seniors. We're not here to banish fruit from your diet. Fruit is fantastic. But understanding potential interactions and effects on blood sugar is crucial. We'll explore 5 specific fruits today, and some might surprise you. The goal is to empower you with information for better conversations with your healthcare provider. Let's get into it. Remember, this is about optimizing your health. Let's kick things off with our first fruit, grapefruit. Grapefruit is often praised for its vitamin C content and refreshing taste. However, for seniors, grapefruit can interfere with a wide range of medications. The main culprits are compounds called furanocoumarines. These substances can block the action of an enzyme in your small intestine, CYP3A4, responsible for metabolizing many drugs. When this enzyme is inhibited, medications aren't processed as they should be, leading to higher drug concentrations in your bloodstream. This can lead to serious health consequences, indirectly impacting leg strength and mobility. Medications affected include certain statins, blood pressure medications, anti-anxiety drugs, anticoagulants, and some antihistamines. If statin levels become too high, the risk of muscle pain and damage increases, causing leg weakness and pain. Similarly, if blood pressure medication becomes too strong, your blood pressure could drop too low, leading to dizziness and an increased risk of falls. Grapefruit juice is just as problematic, if not more so, because the furanocoumarins can be more concentrated. Even a single glass of grapefruit juice can inhibit that crucial enzyme for up to 24 to 72 hours. The concern isn't that grapefruit directly attacks your leg muscles, but how it can turn necessary medications into potential problems. Therefore, if you're a senior taking prescription medications, talk to your doctor or pharmacist about grapefruit. They can review your medication list and tell you whether grapefruit is safe for you. Check the labels of any juices or fruit blends you consume, as grapefruit can sometimes be a hidden ingredient. This diligence is key to avoiding accidental interactions. Prioritizing your medication's effectiveness and safety is paramount, and avoiding grapefruit might be a simple yet crucial step. So, the bottom line with grapefruit? If you're on medication, especially for chronic conditions common in seniors, consider grapefruit off limits until you've had a clear discussion with your doctor or pharmacist. It's a simple conversation that could prevent a lot of trouble down the road and help you stay active and strong. Let's move on to our next fruit, which might also surprise you. Next up, we have bananas. Bananas are often touted as a superfood, packed with potassium, great for energy, and easy on the stomach. Potassium is vital for nerve function, muscle contractions, and maintaining a healthy heartbeat. However, for seniors with certain health conditions, too much potassium can be a problem. The key issue is hyperkalemia, having too much potassium in your blood. Kidney function can naturally decline with age, and many seniors live with chronic kidney disease. Consuming too much potassium from sources like bananas can lead to a dangerous buildup in the bloodstream. High potassium levels can cause muscle weakness, fatigue, tingling, numbness, and in severe cases, dangerous heart rhythm problems. Certain medications commonly prescribed to seniors can also increase the risk of hyperkalemia. These include ACE inhibitors, angiotensin II receptor blockers, and potassium-sparing diuretics. If you're on one or more of these medications, your doctor might advise you to be mindful of your potassium intake. It's not that bananas are inherently bad. It's about the context of an individual's overall health and medication regimen. For someone with robust kidney function and no interacting medications, a banana is a great source of nutrients. But for a senior with compromised kidneys or on specific drugs, that same banana could contribute to a problematic electrolyte imbalance. The takeaway for bananas? Awareness and moderation, especially if you have kidney problems or are taking medications that can affect potassium levels. Discuss your potassium intake with your doctor or a registered dietitian. They might recommend limiting your intake or suggest alternative fruits lower in potassium. Understanding your individual needs and risks is key to enjoying a balanced diet safely. Remember, the goal of managing potassium is to protect your heart and maintain proper muscle function. Let's move on to our next fruit. Pineapple sweet treat or acidity agitator for seniors. Pineapple is sweet, tangy, and packed with vitamin C and bromelain, but seniors might need to approach pineapple with caution due to its sugar content, acidity, and bromelain. Pineapple is naturally high in sugar, which can impact blood glucose levels, especially for seniors with diabetes or prediabetes. Poorly controlled blood sugar can lead to complications like neuropathy, affecting leg strength and mobility. Portion control is key. Pineapple is also quite acidic, which can be an issue for seniors with acid reflux, GERD, or other forms of indigestion. Consuming acidic foods like pineapple can trigger or worsen symptoms like heartburn and chest pain. Chronic discomfort from acid reflux can reduce overall quality of life and activity levels. Bromelain, the enzyme in pineapple, has anti-inflammatory properties but can also increase the absorption of certain medications and have blood-thinning properties. If you're on anticoagulant medications, consuming large amounts of pineapple could increase your risk of bleeding or bruising. Some individuals can experience allergic reactions or sensitivities to pineapple. Symptoms can range from mild mouth irritation to more significant reactions. The main considerations for seniors are its high sugar content, acidity, and the potential effects of bromelain. Enjoy pineapple in moderation as part of a balanced diet. If you have diabetes, GERD, or are on blood thinners, discuss it with your healthcare provider. They can help you determine if and how pineapple can fit into your healthy eating plan. The goal is to enjoy food while supporting your health. Being aware of these potential downsides allows you to make informed choices. Let's move on to our next fruit. Mangoes deliciously deceptive for some seniors? Mangoes are rich in vitamins A and C, antioxidants, and fiber. But seniors should be mindful of their high natural sugar content. For seniors managing diabetes, consuming large portions of mango can lead to significant spikes in blood sugar levels. Consistent blood sugar fluctuations can contribute to diabetic complications, including peripheral neuropathy. A medium-sized mango can contain a substantial amount of sugar. Portion control is paramount if you have diabetes or are at risk. Mangoes are also relatively high in calories, which could contribute to unintentional weight gain. Maintaining a healthy weight is important for seniors as excess weight puts additional strain on joints. Mango skin contains urushiol, the same compound found in poison ivy, which can cause allergic reactions in sensitive individuals. If you're sensitive to urushiol, avoid contact with the skin or consider avoiding mangoes altogether. The fiber in mangoes can be beneficial, but for some seniors with sensitive digestive systems, it might trigger symptoms like gas or bloating. The key takeaways for mangoes are managing sugar intake, being mindful of caloric density, and considering digestive tolerance. Enjoy mangoes in small controlled portions. If you have diabetes, monitor your blood sugar response. If you have a known sensitivity to urushiol, take precautions or consider avoiding it. Discuss any concerns with your doctor or a registered dietitian. The aim is to integrate these delicious fruits into your diet in a way that supports your health goals. Let's move on to our final fruit. Papaya enzyme-rich, but any risks for seniors? Papaya is rich in vitamin C and A, folate, and dietary fiber. It contains an enzyme called papain, known for aiding in protein digestion. One primary consideration with papaya is its latex content, especially in unripe or semi-ripe papaya. For people with a latex allergy, consuming papaya can trigger allergic reactions. Papain can also pose a risk for individuals on blood thinners like warfarin. Papain may have blood-thinning properties, increasing the risk of bleeding or bruising. The latex in unripe papaya can stimulate uterine contractions, but this is primarily a concern for pregnant women. For most seniors, consuming fully ripe papaya is safer. Overconsumption could lead to digestive upset in some individuals. If an allergic reaction occurs, it can cause discomfort and reduce overall well-being. If there's an interaction with blood-thinning medication, it could affect mobility and comfort. Choose fully ripe papaya and consume in moderation. If you have a known latex allergy, avoid papaya or proceed with caution. If you are on blood-thinning medications, discuss with your doctor whether regular papaya consumption is safe. Papaya can be a wonderful addition to a senior's diet, offering valuable nutrients and fiber. Being aware of these potential risks allows for more informed consumption. Let's wrap up with some final thoughts. We've covered 5 fruits: grapefruit, bananas, pineapple, mangoes, and papaya, and why seniors might need to be more thoughtful about incorporating them into their diets. The key takeaway isn't to fear these fruits but to understand that healthy isn't always a one-size-fits-all label. The goal is to empower you with knowledge. Stronger legs and overall vitality come from a balanced diet, regular exercise, and smart health choices. Use this information as a starting point for a conversation with your healthcare provider. Ask them about these fruits in the context of your health and medications. If you found this video helpful, hit that subscribe button and give this video a thumbs up. Stay informed, stay proactive, and here's to your health and strength. Thanks for watching.